Today we're going to talk mostly about the interview. So here's what we're looking for during an interview. We're looking for communication skills, interpersonal skills, your maturity, and we're going to go into each of these in detail. Again, your understanding of a career in medicine and the ability to think on your feet, meaning in real time. If you're handed a problem, what do you do with it at that moment? So communication skills can be broken down in a number of things. One is active listening, and that just means it's a counseling term. Active listening is really just reflecting back to somebody what they've just told you to make sure that you actually understood what they said. And it's a key piece of relationship work because you think you understand what somebody told you, but you may or may not understand what somebody just said. Eye contact is pretty important. We realize there are cultural differences with eye contact. In some cultures it's considered disrespectful to make eye contact. We don't always know that, and so as best you can, depends who's interviewing you, whether they understand that or not. Best you can, it's a good idea to make eye contact with the people who are interviewing you. We'd like you to try to be as clear as you can without going on and on and on and on and on. There are some questions that you should be able to answer very quickly, very short. There are other questions that we want to hear more from you. And the key is knowing the difference. So when we ask you why you want to be a doctor, it's hopefully in your personal statement. We've read it before. We want to hear it from you mainly as an opener because you're expecting that question during an interview. And if we jumped right in with a difficult ethical scenario, we would make you very uncomfortable. So we usually start off with something we think you've thought a lot about, which is why you want to be a doctor, and you should be able to bring that to us in a sentence or two, really. That's a place for maybe a short answer. The other is obviously making yourself understood so that we know what it is you're trying to tell us. How do you get better at this? One is something called Toastmasters, which is a national organization. There is a branch here at the University of Washington. I think there's more than one branch here at the University of Washington. And it's a group in which it's typically people who are not so good or uncomfortable with public speaking, and they want to practice. And you go in with this group. They're often at lunchtime. You bring your lunch, and they give you a topic of the day, and you just have to get up on the spur of the moment and talk about it for 5 minutes. And then the other people in the room give you feedback on that. So it's just a way of getting used to talking to people you don't know. Dale Carnegie wrote a book a long time ago, again, How to Win Friends and Influence People, and it was suggested to me by one of the pre-meds, actually. The third is practicing talking to somebody that you don't know, and this is a great pickup line, actually. I'm trying to apply to medical school, and I need to practice my listening skills in which you talk to me, you know? Who knows? Anyway, but again, there you can practice active listening. Like somebody says something to you, and you say, this is what I just heard you say, and you repeat what you think they said and see what they say after that. And then also just getting feedback from the person you're talking to about whether you sounded clear in what you said to them, or they didn't understand what you said, you know, and just getting feedback. If you're talking to people that you know really well, they're pretty sure they know where you're coming from, and so they're likely to assume things that we won't assume when we meet you because we don't know you. So if you made some not so nice remark, for example, and I were your mother, I would say, I know you didn't mean to be obnoxious, but you were when you said that. Whereas somebody you don't know won't give you the benefit of the doubt. So it's just a good idea to talk to people you don't know very well. On the interpersonal skills level, we're looking for empathy in particular. It's a critical skill to have in medicine, and I don't even know if you can learn empathy. Hopefully you can. To a certain extent, it's just who you are, and it really means being able to put yourself in somebody else's shoes. It's not the same as compassion. Compassion is more like, I feel sorry that this has happened to you. Empathy is more like, oh my goodness, if I were in your position, this is how I would feel, or this is what I would do. And during the interview, either in a scenario, whether you are role-playing or you're just being asked a question, you need to be able to put yourself in that other person's, the patient's shoes, and try to work with them as though they were you were the patient in the essence. How would you feel in that setting? We want to see if you're respecting somebody else's wishes and concerns. That gets called patient autonomy in the medical scenario, but if you're given a scenario in which the patient wants something and you don't agree with what they want, what do you do with that? We hope what you do with that is that you try to ask them questions to get a feel for why they're coming from the position that they're coming from. Why do they feel that way? Rather than saying, no, you don't understand, you really shouldn't do this, that kind of thing. And again, being non-judgmental, I've already mentioned about integrity. Being non-judgmental means that even if you don't agree with something, you're giving somebody the space to have their own opinion and thoughts and cultures and backgrounds and all of that. So being judgmental is one of those things that's sort of a kiss of death during an interview. If you put your own value system on somebody and you're not listening to them and you're not even asking them what's important to them, that's really not good in an interview or in your life in general. And so sometimes some interviewers will push you a little bit to the wall where you'll be asking questions and they'll say, but you need to make a decision, you need to make a decision. And that gets a little tricky, and I think the way around that is to just say, well, based on what I've heard and based on what I know and taking this into account and taking this into account, this is probably what I would suggest. But really give all the reasons for it if you're pushed to do something like that. Maturity is a little difficult to define, but here are some of the features that we think about when we're talking about whether we think somebody's mature. Probably the key is how well that person knows him or herself. In essence, that's really what it's all about. So certainly the longer you've been around, hopefully, the more mature you are. That's not always true. Again, the more you try to take away from every experience you have, the more mature you're likely to be. So again, knowing who you are, recognizing the needs of other people clearly, whether you can function in a stressful situation, and we really are not trying to make the interview a stressful situation on purpose. It is inherently, and we recognize that, but we're not trying to push you in that way. We expect you to have been responsible. It helps if you've been on your own, you've been somewhere else, out of your home neighborhood, out of your home environment, and you've functioned well in that setting. And of course, coming in as confident as you can seem without being cocky is also something we'd like to see, that you're comfortable in your own skin, really. So how do you get better at that? Well, we're back to experiences again. Again, try to take some responsibility, try to get out of your own comfort zone, and just get out there and live, basically, but try to, again, go out of your comfort zone and where you've lived all your life, whether geographically or ideologically, something. And again, if you could try to journal, that will help. You can ask other people for feedback. I was talking to somebody earlier today about journaling, and we realized that some people have difficulty even doing that. Like, how do you self-assess if you're not good at self-assessing? What I said was, try to ask yourself the questions that I would ask you if I were sitting there with you. If you said, I did such and such experience and I had a great time, and Dr. Tights would say, well, what was great about it? And then you might say, well, it was just fun. And I would say, well, what was fun about it? And things like that. And just keep pushing yourself to try to get more and more and more detail. As this person said to me, things were crystallized inside his or her head. And I said, that's great, but you need to expose that to the public because we can't see what's inside your head, So it all has to come out. Okay, understanding a medical career. This, again, is about making an informed choice so that we know you're making an informed choice. You should have some general understanding of the differences between different types of practice, what it takes in the way of time commitments. In particular, whether we mentioned earlier some people who had said in the past they want to do bench research in a rural setting, which doesn't make sense, things like that. In terms of issues that you should be aware of, they should be things that might be local health issues, perhaps regional health issues, some national health issues. And the list here is some of the things that might fall under that. And just to give you some example, in a certain community, let's say that there is a major problem with diabetes or a major problem with alcoholism or a major problem with obesity. And if you're from that community and you don't know that, that's kind of surprising to us, because if you're somebody who's interested in going into medicine and you come from a community in which there is a specific medical problem in that community, we would expect you to have an interest in that, or at least know that it existed. So we've had people come to us from different communities around the region who don't know, for example, that there's, let's say, a high rate of tuberculosis in their community. or a high rate of diabetes or any of those things, and they're just not aware of it. And so when they're asked what are the health issues in your community, and they, I don't know, well, yeah, You should understand sometimes people will tick off this kind of a list in an interview, and we know these things are out there on websites, and so we would expect a little more thoughtfulness perhaps. So for instance, access could mean transportation. People can't get to where the medical care is offered. It could be that the clinic that they're going to isn't open during the hours that they can get there. It could be that nobody in that clinic speaks their language. That's all access. So when somebody comes in and just does a slam dunk interview, they're telling us all those details of things like that. That's the difference between an 8 on an interview and a 6. This would be a 6 on an interview, which is a good score, and an 8 on an interview would be, well, people work all day, and if the clinics are only open until 5 o'clock and they can't take off work, they can't get there. They can't get babysitters. They can't get there. Or they don't speak English. They won't come. Or they, that's a really superb interview. In terms of the role of the physician in the community, again, we want to make sure that you understand that most physicians are not on pedestals. They are reasonably well respected. But if you need to be on a pedestal somewhere, you're probably in the wrong profession, and I honestly can't think of one where you would be on a pedestal. These are some resources, and I'm not going to spend time on this slide because they're, again, on our website, and they're all over the place. Probably if you Googled healthcare issues, you probably find most of these. I also want to mention that for at least those of you who are here at the university undergrad still, that there are many, many pre-health organizations, and they have mailings that they put out all the time because I'm copied to some of them, and they're always putting out things like this, resources where you can get more information, or people that are coming in to speak and things like that. So thinking on your feet, this is more about analytical ability really, and again we put a sort of a basic outline of how to approach a problem on the website. And you may get this in the form of a case scenario, hypothetically, or a role play. And these examples down below are some of the issues we tend to ask questions around. And again, we don't expect you to be fully fledged, capable of talking about all this in a well-educated way, in the sense that you'll learn some of this in medical school, clearly. At the same time, you should have thought about some of these on your own and how you feel about them. So for instance, end of life, you should have some kind of feeling about how that sits with you, especially since the state of Washington just passed a law about that. So we would expect you to know that that happened around here, and you should have some feeling about it yourself. So that's the kind of thing we would expect. So the case or cases that you will be presented may not all be ethical issues. We don't always do ethics. Sometimes we do, sometimes we don't. We just use that as a way to see how you think in real time. And really what we're looking for is the process, more so than the answer. That's very hard for people to get when they're applying, but the worst thing you can do is jump to an answer. So somebody gives you a scenario and you say, I would do this. That's a big black mark, basically, or red mark, or whatever color you like as an X. But generally, if you're jumping to a conclusion, you haven't found out where the patient lives. What's important to the patient? What are they thinking about this issue? That sort of thing. So sometimes people tell me after the fact that this is what they were thinking, but again, we can't see inside your head. And so we don't know what you're thinking unless you tell us what you're thinking. This is a place where you need to have a long answer rather than a short answer. What we want to know is, do you first understand the problem? Do you have the ability to gather information? Can you generate more than one solution if the scene changes? So you might come up with one solution, and then your interviewers will say, well, what if this patient that I just told you about that was 16 is 80? Let's say they need a lung transplant or something. They just gave you a scenario in a 16-year-old, and now they're going to give you the same scenario in an 80-year-old. Does that change your thinking? How does that change your thinking? And we want to know about that. So the solutions that you come up with should be informed by data that you're collecting on the spot, which should include the wishes of the family and the patient in the reverse order, the patient and the family. And again, willingness to change your mind if something's different about the situation that you're being given. So I guess we're looking for some flexibility there. I guess that's another word I didn't have in here. So here's an approach. One, and this is what we teach here. We teach a problem-based learning in this school, and I used to run it. So the first key is defining the problem. So if somebody's asking you a question, it's not a bad idea to quickly repeat the question. Again, that's active listening, and you make sure you're answering the right question. So you want to make sure you understand the scenario, and it's very easy to say very quickly, okay, here's what I understand that you just told me. This is the setup, right? And then you tell us what you already know about that. This wouldn't happen if you're in a role play, you wouldn't necessarily do it that way. But if you're in a hypothetical scenario, you would tell us what you already know about that problem. Let's say it's a lung transplant person waiting on a transplant list. You might tell us what you know about lung transplants or availability. If you don't know anything about it, just say, I don't know anything about lung transplants, but here's how I would go about getting information about it. And you need to recognize what you're missing. So when we teach this in this school, we talk about what's the problem, what do you know about the problem, what do you need to know about the problem, how are you going to find out, and what are your alternative solutions to that problem. If you're in a role play, the way that you gather information is you're asking questions of the patient, you're asking questions of the family members if they're in the role play. That's how you're gathering information, and you're adding that to the information you already have in your head. And when you speak to the patient in a role play, you're mixing that all up and putting it back out. So you might be saying, I hear you saying that you're afraid to have a lung transplant, or your parents are afraid for you to have a lung transplant because they're afraid you're going to get HIV. From what I know about transplants, it's highly unlikely that you're going to get HIV from a lung transplant, or something like that. So you're combining what you heard from the patient and what you know yourself. And then you might offer some solutions about that situation. And again, based on your solutions should be based on the information. It's fine to reiterate the information as you present the solution. So again, don't be afraid to say, I don't know, but don't stop there. So if you say, I don't know, we all face that almost every day in the practice of medicine. We see something we've never seen before, or we're seeing a problem in a type of patient we've never seen before, or it has just a different presentation, and we have to take a step back and say, this is different. What am I going to do with this? So the reason this is so important to us when we're interviewing you is this is a very common scenario in the practice of medicine, that you're faced with a problem where you don't really have the answers, or at least a good answer necessarily. So then you have to step back and say, okay, here, what am I going to do about that? So when a patient's in your office in that setting, you usually say, I'll give you one example really quickly. A patient that I had this past year that I've been seeing for 25 years who started developing arthritis. It was pretty rapid. It was pretty weird. And I said, I don't know what this is. And we talked about different kinds of arthritis. And he says to me, this is going to be pretty bizarre, what about hemochromatosis? I've been reading about that on the Internet. To which I had to say, boy, I haven't thought about that disease in a long time. Show me the site on the Internet. So we pulled it up on the computer, and sure enough, he had the hand findings and he had the spine findings, and we ordered the iron tests, and there it was. So it was really very cool. But the point is that the patient brought it up, and I didn't say, oh, don't be ridiculous, hemochromatosis, you're not going to have that, And it would have been very easy for me to say that because it's usually a disease that shows up when you're very young. It's an iron overload disease. It's hereditary. The guy is 60 years old, never had a problem before, but it turned out he'd been a blood donor, which is the treatment. He'd been a blood donor for years and years and years and years, and only 10 years ago he got a really bad systemic infection and they wouldn't let him donate blood. So it was a great, great example scenario. Anyway, sorry to digress. Just tell us if you don't know something, say, I don't know, and here's how I'm going to find out. And that works really well because we all do that. So there's really no such thing as a wrong answer. Really, honest, really, really. Trust me. But there are wrong approaches. So the wrong approaches are that you come to a snap decision and you put it out there with nothing. You're not saying anything to tell us why you've come to that decision. You're judging the person, perhaps, or you're imposing on the person, you're imposing your opinion on the person when you disagree with them. Those are all three things that are really, really negative in an interview. Again, how do you get better at this? Well, here we go back to practicing with others yet again. So you have many opportunities to make a lot of new friends. You should think about some of this ahead of time. So again, you're not, the less in the dark you are, the more comfortable you're going to be, really. Here are some resources, which again you can get from our website. We also posted a whole bunch of, somebody wrote in to us and asked about resources for ethics questions, and I think we posted a few books or something like that. And then I would suggest that you take a problem-solving approach to decisions you're making now in your life that have nothing to do with medical school, and just play with it and see how it works. So if you're going to buy a car, how do you gather information about that car? Do you first decide yourself whether it's about the color or the style or the mileage or the money? How do you decide that? And then do you go and look at, compare mileage of this car to this car to this car to this car, that sort of thing. And then ultimately, how do you make the decision? It's the same process. So here's the sample scenario, and then we'll stop and go to the Q&A. The sample scenario is, I'm a 16-year-old female who wants birth control pill, and I don't want you to tell my parents. And there are a number of issues that come in there, but here are some things that you might say that would not go over well. And 3 of them are negative, sort of, and 1 of them is positive. And so you might feel really good about yourself as an applicant of saying, sure, birth control, no problem, I'll give it to you. That's still a wrong answer, in a sense of wrong answer, because it's the wrong approach. It's not a wrong answer, it's the wrong approach. You just jump to it a little too quickly. Here are some things you might ask that person, not necessarily in this order. Are you sexually active? Somebody's asking for birth control pills. Do they really understand what that's all about? Maybe they're asking for birth control pills because they think somehow they won't get AIDS if they're using birth control. Who knows? So that's usually the first question, but it doesn't have to be the first question. And then all of these others, have you considered other forms? I wouldn't say, have you considered? See, I wrote it better than I said it. If you say, have you considered, you're asking a yes-no question, and you're not going to get as much information out of your patient as if you ask an open-ended question, which is something like what? What types of birth control have you considered? But these are just additional examples. What's your understanding of health problems that could arise from having sexual intercourse? See if they know anything about getting sexually transmitted diseases other than getting pregnant. Maybe making some positive comments and trying to delve into why do we not want to talk about this with your parents. And it could be that at the end you decide you're not going to talk to the parents, and that might be okay. But again, you should have come to that for some reason. And you might decide you would, just your own feeling, you would prefer to talk to the parents, but you need to agree with this patient if you're going to do that, or can we agree that I won't talk to to your parents until you've talked to your parents, or would you rather we talk to your parents together? Would that work for you? Or any number of things like that. So you just need to be asking questions, don't just make decisions.